Okay, so we're going to pick back up where we left off on the situation tab in the diagram subtab. We'll go to events. Now I talked earlier about picking your dispatch complaint and it having some effect later on. We have what's called quick actions here. We can input treatments two different ways. This is a full treatment area. So let's say we started giving Mr. Decker some oxygen. Okay, 5 minutes ago, I click on the oxygen tab. 5 minutes ago, it populates that. If I hit enter, I can hit enter or just click into the next box here on the left. It's a nasal cannula, 6 liters per minute, enter, performed by, and I can click myself and put any notes in. I do not need to put notes in. I can just simply click off of that. If I go back to here, and remember I talked about the option of putting in other members at the beginning of the report, now I can click select others and pick from other people in my department. And for some reason, it always asks if it's prior to arrival. I'm just going to leave that blank. There's no need to put yes or no, but we can leave that blank. And then I come down here to the right and hit submit. Now, again, if the Tough Book or whatever computer you're working on is already up in the back of the truck, we have these quick actions. Now, something we need to remember with quick actions is all it does is click the treatment and click the time. It timestamps it. So if I click the quick actions, I can put on here that we, and again, these fields for treatment and drugs are based upon what the complaint was. Remember, we picked respiratory distress. So with this gentleman, we've already done oxygen, but let's say we wanted to do a 12 lead and some albuterol. I'm going to click 12 lead and it timestamps it. And then we can hide this or leave it up. If I hide this and later we do albuterol treatment, quick actions, I will click albuterol and hide that. Now the problem is, you'll see later, we have to go back in and list our specifics. Who done the 12 lead, how much albuterol we give them, etc. So I'll just leave that for now. Vitals. Again, let's say 10 minutes ago we started to work on this gentleman.
Get food on now, get food on.
It's time to eat, so I'll finish this up. 140 over 80. Heart rate was, let's say, 100. Respiratory rate, this guy was breathing. Remember, our difficulty breathing was the issue here, 20 times a minute. SpO2, 85%. End tidal, the rest of this we can click NA. Capillary blood glucose level. Now remember, this was a diabetic, so we did check his sugar. In this case, his blood sugar was 132. That is part of the vitals. That's not a separate check. Temperature. And A, I'm going to scroll this down just so you can see what I'm clicking on. His position, he was sitting when we took his vitals. His EKG, normal sinus rhythm, performed by me. He doesn't have any pain, it's just difficulty breathing. The rest of these fields are dark, so we don't really need to put anything in there, but I'm going to click NA just to populate the field. And again, this prior to arrival for some reason shows up. We have to give this gentleman a GCS. Everything is okay, 4, 5, 6, so he has a perfect GCS of 12. And that is our vitals. If we would click, if we would take another set of vitals, all we do is click vitals. So we're done with treatments and vitals. We can always come back to that if we take another set of vitals or if we start any other treatments. So on his summary, patient disposition. The patient was transported. And this, for some reason, always takes a little bit of time. So once you click that the patient was transported, give it a few seconds to bring up your populated box for your destination. In this case, we transported to Mount Carmel East. That was the closest hospital. It was non-emergent. And the patient did have some improvement. So we're going to click that. And of course, we're going to document that in our narrative. If we are diverted, for some reason, the state takes statistics on that. We'll click that we were diverted and our destination originally was maybe Grant Medical Center, but they're on diversion and a reason why. And we would type in that, in this case, it's the Franklin County Transport Plan, and that was busy. Signatures. The only signature that is required, again, we do not bill, is the primary medic. So we'll click on that, and we can use a pen or a pointing device. And it always looks horrible. So in this case, so I don't reach in front of the screen, there's my signature. A few other signatures we can put in is the patient to sign, And in this case we're billing, they sign consenting to the use of their Social Security number for billing and the acknowledgement that we're going to keep their information private. If it would be a patient refusal, sometimes maybe if we use narcotics, and I'll show that in another tutorial segment, then the assisting medic and the witness of any disposal of narcotics would have to show up there. So in this case, we just have the medic signature. I am going to have to, because on this computer they do bill, put something in here, and we're going to say the patient was physically unable to sign. Maybe they're on a backboard and with the physician. So I click that, and then the medic signatures testifying to the fact that yes, this patient could not sign. So here's our narrative. Click on narrative, just like any other narrative. And I would want to go through. Now the printed report lists the treatments very detailed. Time, date stamp, amount, whatever. So I don't really need to list that in here. So if I click on that, a second box comes up. Test narrative. I'm going to hit submit. Now we can type in this box here if we want to. A lot of times it looks better in a bigger box with a bigger picture. So we can type in here if we need to. Test again. And this also has an auto narrative. If we want to pick it, we click this. I just don't like how it words. The following 3 treatments were performed. If I look here on this line, administration was administered at 10:36. The following details were noted. It just gets too wordy. The other thing is if I use the auto narrative, I like to take my time and bring it over here to the left side. At 10:36, we administered oxygen 6 liters per minute by nasal cannula. So I don't really like that auto narrative. So this should turn red once I click off this box. We have a CPR box that the state collects additional information if we have a cardiac arrest. And we should be done. So I'm going to click validate, and it should tell me if I have any errors. Now remember, I put 2 treatments in. On the quick action buttons, it's probably going to ask me for additional information. Oh, mileage, district, and here's my medication administered. Another one is I didn't put my vital time in, the time of the vitals in. That is before my scene time. So I'm going to click on that, and it's going to take me right to it. And for my scene time, I'm going to back that up. I don't know what time. We'll see. Let me do 28. We'll see if that fixes that. So I'm going to click validate again. And if not, I'll just change my vitals time. It did. Took care of it. So my medication. Remember, I did a medication, and it's going to ask me for my dose, units, and route. Because all I clicked was the quick action button for the medication. It time-stamped it and told me that I give albuterol. I can see here. So now I have to put my dose in. 1 point. Let me back that up. I can hit back or clear. Back it up one spot. 1.5. Enter. Milligrams. That was by a nebulizer performed by Darren Decker. I can put some notes in. Patient reports relief with treatment. I don't have to put anything in here. It's not required. And again, prior to arrival, I'm just going to leave that blank. Let me click my validate button again. I need a district. Remember, I didn't click district. And a mileage, start and end time. Those are down here at the bottom. We do not bill at Madison Township and Licking County, so all we need to do is put something in there to populate the field so it doesn't show an error. If you bill, you'll need to record an accurate mileage. I'm trying to get it so since we don't bill to have this removed as a requirement. Click enter to make sure it took that and validate. District. Forgot about district. So you can see this takes me right back to where I need to be. So I'm going to click 9440. I don't know what this means, but it's a requirement to click district. Some, again, for billing purposes, if it's out of the township.
I'm worried about you. Runs is ready.
I'm going to click validate again. And we can see that our patient report is complete. Now, once I click complete, it's done. I can't go back. I have to ask for an administrator to go back to it. So I'm going to click scroll down through, and one thing I want you to see here is treatments. You can see here timestamp 1042. It's a medication administration, albuterol 1.5 units by nebulizer performed by Darren Decker, and the patient reports relief with that. So there's no sense in going back through in my comment or narrative section, and you can see here this is my narrative, test narrative, right below my treatment. There's no reason for me to type that in a second time, so I really like how the patient report is laid out. Here's all my call times and the paramedic signature. So in the next tutorial, we'll go over a few exceptions with this. Oh, before I close this, we can click the print button if we're connected to the emergency department's printer, or we can fax this report. So if I click fax, a box will come up that populates. I've transported to Mount Carmel East. That's an auto-populate button, and I click send fax. Or if for some reason we changed and went to a different department, emergency room, then I can choose to change that location, but it pre-populates to whatever you click as your destination. So I'm not going to fax this practice report. I don't want to cause any confusion, so I'm going to click cancel. I'm going to click go back, and then I'll be able to validate it again and close this report. But before I do that, in the next tutorial, I want to show you a few exceptions.